On that note, such a positive note, I'm really inspired, and I think that it is possible. That is something we should keep with us, and girls are in the center. So one of the ways that is possible is through partnerships and through collaborations. So I want to welcome back up on stage Jessica Dorney-Schwartzman and Sandra Jordan. Jessica from the Family Planning 2020 Initiative, and Sandra Jordan, who works with external relations as Senior Technical Advisor at USAID. They will have a collaborative discussion about partnerships.
Follow Dr. Babatunde because he's always so inspiring and hard to follow, but we'll do our best. So yeah, I'm Jessica, and as they mentioned before, I am working on FP 2020. It's been a really, really exciting movement, and I've been focusing mostly on the Performance Monitoring and Accountability Working Group in Rights and Empowerment, and I see a lot of my colleagues out here. But I've been at the UN Foundation for almost 4 years, so it's great to be a part of this event.
And I'm Sandra, and I've been with USAID almost 13 years, which is kind of shocking. It's still not working? Okay. And Jessica and I are a perfect example of partnerships because when she started working on rights and empowerment, we became very good partners. So I'm really pleased to be here with her. And so how do we forget how we wanted to start this.
You're
going to let me start. Okay, I was just going to kind of give a brief overview on USAID and our partnerships. And when I first started at the agency, now that I revealed how long ago that was, USAID was increasingly getting into partnerships because they saw how the development agenda was changing, how resource flows to countries were changing, and it just started making a huge amount of sense to not keep going it alone. And there have been increasing numbers of donors coming on board, so cooperation got to be really, really important. So we began working with an array of non-traditional or non-conventional partners as defined by development agencies up until the 90s and early 2000s. And so we've done everything. We've partnered with everyone from pharmaceuticals to industries, both within the US and within Europe and developing nations. And we just tried to leverage money better so that we could do more for the women that we're trying to serve. And we've worked in other than the company partnerships, we also have realized increasingly with the development agenda that donors weren't coordinating quite as well as they should. So we've started several partnerships to just get better donor coordination going. One is the Alliance for Reproductive, Maternal, Newborn, and Child Health. And the other is the Ouagadougou partnership that they spent a day yesterday kind of going through this, that we partnered with the French government and several foundations, including Bill and Melinda Gates and I'm just lost at Hewlett. And so we're seeing that this is working, and what we have seen through all this too is that it's really essential to force donors to work together because we don't necessarily sit down and think to do it. If you have weekly phone calls, you do. So that's been a really good idea. But now we're also part of the biggest partnership of all, and this is where Jessica gets to step in.
Yeah, so FP 2020 is a global partnership that really carries forward the momentum of the 2012 London Summit on Family Planning. And it was established to really, as Sandra said, increase coordination and collaboration, and is a platform for knowledge sharing and to share best practices, emergent thinking, and to allow both donors, the private sector, countries, and civil society to really align their agendas and really, utilize existing structures, not create new or duplicative structures, but to build off of existing structures, really to deliver for the promise of reaching an additional 120 million women and girls with access to voluntary family planning, information, services, and supplies by 2020. And FP 2020 has a governance structure by which we all work, and that includes a reference group, which Babatunde is the co-chair, a task team, and we implement day-to-day activities. It's hosted at the UN Foundation, and 4 working groups. My brilliant co-host here is on the Rights and Empowerment Working Group, and there are other colleagues out there that are on working groups. So we have the Rights and Empowerment Working Group, Performance Monitoring and Accountability Working Group, Market Dynamics, and very much importantly, the Country Engagement Working Group. But I was at a panel yesterday where people were talking about FP 2020, and someone mentioned how important it is to recognize that the governance structure is a place to start, but this is really a movement. And we've seen so much. I think one of the great things about FP 2020 is that it's given visibility to the issue, but also energized. I think so many people were waiting for a moment in particular for family planning, and it's I think almost 25,000 individuals have reached out and said they wanted to be interested and engaged in this. So one of the important things about FE 2020 is to keep this, harness this energy to move forward to really deliver for these women and girls. And so I think there is this huge constellation of partners, but countries are really at the heart of this partnership. And they are really the ones, we're launching our first progress report tomorrow, which is very exciting. But they're really driving progress and delivering on the commitments that they made. So at the London Summit, 24 countries made commitments, policy, service delivery, and financial commitments. And over the past year, over a quarter of these countries have developed new and launched new costed, detailed family planning plans, which is amazing. 1/3 of the commitment-making countries have already increased their national budget allocations, including our host country here, Ethiopia. And half of the commitment countries have held national family planning conferences. And we're really hearing from the governments and civil society themselves that these are great moments to really profile high-level political commitment. I think in Indonesia, when they had theirs, there were almost 1,700 people there that attended within the country, including the vice president. So, yeah, and so that's kind of the broad countries, but I know USAID's doing a lot of work down to the community level.
Yeah, so kind of echoing what Dr. Oshtoman was saying, we feel that social transformation is really part of family planning, and so often it's looked at as either health or this or that, and we just think it's really transforming society simply because giving women the access and right to contraception and allow them to plan their families is kind of a huge concept that really hasn't quite been adopted in my country. So there are obviously many countries that can use we need some social transformation as well. So we do work closely at the community level, understanding all the big partnerships are important, but many of our implementing partners really dig deep into the community, working with community-based health workers who take supplies out to remote health centers in the mountains and such, and you kind of see these workers walking from a hospital base and walking here in Ethiopia 20 miles uphill to get contraceptives to a remote clinic, and you're thinking, you do this every day? And so the dedication of women and men who want to make these services available is extremely impressive. We build on social franchises through MSI, and that's taking private clinics that are very much respected by the community and training them and teaching them in family planning and letting them make things accessible. So we've got both the public and the private going. And working with community leaders to kind of put the seal of approval on family planning, on the fact this happens. We've got a lot of programs working with mothers-in-law who sometimes can be a barrier to access, or husbands getting a lot of male involvement going, and this is very much done village by village at the community level. And so that kind of, I've got a million examples. I'm trying to be mindful of time. And Jessica, what?
Yeah, so I mean, I think one of the challenges you talked about were, making sure that women and girls have access to a full range of methods, and no matter where they live, that should be an option, and to ensure that they are of high quality and that they can make informed choices. And in order to do that, I think at FP 2020, there's been a lot of focus on ensuring that women, when they're getting these services, there's a broad range of methods in the method mix. And, I think innovation is something else that FP 2020 has really focused on as a core principle, and that collaboration, is essential in order to innovate. So some of the most exciting innovations over the past year have really been between the public and the private sector, and using market-based solutions to ensure that, to solve some of these problems. So some of the exciting things, that have come out of this are both that there are important underutilized commodities that are in demand that have had, 50% price reduction, and that is making, this is a public-private partnership that USAID is a part of, the Gates Foundation, UNFPA, Pfizer, DFID, and so they all came together to work to make sure that, these commodities would be available when people want.
We did this through Merck and Bayer, and I see
Merck and Bayer,
partners
right.
in the room, so thank you.
No, that's right. That's right. They were on the long-acting. Yeah. I was thinking about the injectable contraceptives.
I'm sorry about that.
Yeah.
We're
Which
not such
are
good
soon
partners.
coming out. They're starting to pilot those programs as well. So it's
Okay.
very exciting. And I know, I think we talked a lot about the private sector and how, these public-private partnerships are important, but I know USAID is also working closely with the faith community, which is a different.
Yeah, a lot of people don't think you can say faith and family planning in the same sentence, but actually you can. And we started working very extensively with faith communities many, many years ago, even before George Bush. So we've recognized their value to our work for a long time. Given that 90%, or an estimated 90% of the world's people adhere to some religious belief, it would be really hard not to work with the faith community, and many of them really do want to work with us, even Catholic ones, and we have nuns that deliver condoms and other forms of birth control. We just don't tell the Pope. But maybe we can tell this one. We can see. And we also work with imams and mullahs and other Islamic religious leaders, work with Christian leaders, Jewish leaders. We even had a program, actually, that got us in trouble with George Bush because we're working with Suzanne Petroni sits right up and listens to that. We work with traditional faith leaders in Haiti, which is voodoo, and they got very upset saying that wasn't really a religion, but tell the Haitians. So anyway, we do work very closely with these people. They make it possible for us to do that social transformation we were talking about, to change hearts, to change minds, to gain acceptability for reproductive health, for the fact that women can be equal members of society, that they can get education, that they can contribute to the community, and ultimately make huge contributions to their countries. And a lot of religious leaders help us a lot in doing that.
So some good last words, I think.
We did get one question from, or a few, I think. I want to introduce our Twitter moderator, Matt Matassa from FHI 360, and he has a question for the panel.
Okay, we have a question that says, how do we ensure the voice of women and girls are heard in this discussion?
That's a good question. So, I think this constellation that we talked about with these stakeholders, and since we're here on technology, I think utilizing a lot of the platforms that we have to reach out and engage these communities. I think within the working groups that we have, we really made sure to have a diverse set of partners, some that represent youth, in particular, and come from community-based so they can, engage with these populations on a very regular basis, and that there's a feedback loop there. And I think, also it's really important to have women and girls at the table when there's program design and country plan development, and I think that's something we're going to be really committed to.
Excuse me, USAID has a new youth policy, and one of the things we're doing with this is not talking so much about youth-centered programs and making them youth-run and youth-created programs, because 40-year-olds creating programs for youth may get it wrong. And so we're working very hard doing that. And then a lot of our community outreach, when we do a lot of sitting under the banyan tree talking to the communities, and we make sure that youth are there in those meetings and hearing what's going on and that they have a voice in all this. So it's not that we just trot them out for national and international meetings. They're there in the community meetings under the tree and such. So.
Thank you. And we will hear more about youth engagement. I always like to say that young people are not the future, they are actually the present, and we have so many young people who are leading the way, and we will be hearing from a few later in a separate panel. Thank you so much.